Okay. So welcome to the Nurses Climate Challenge for Sigma Chapters webinar. I'm Dr. Daria Wazak. I'm one of 5 Sigma chapter leaders who were grouped together in our last Sigma Academy on global advocacy. And our project was to promote ANNIE's, the Alliance of Nurses for Healthy Environments, Nurses Climate Challenge. Individual nurses and schools of nursing can sign on to this challenge, but now through our project, Sigma chapters can sign on too. So we're seeing the interest in this webinar, although we don't have everyone here yet, but I had about almost 50 different chapter leaders sign on that they're interested in this webinar, and they were from all around the globe. I had people potentially coming from Australia, Egypt, Sierra Leone, England, and more. And this just shows Sigma is a great forum for us to come together on this important topic and to promote climate and health. We have 2 presenters over the hour. Please save your questions for the end. We hope to have time for some discussion. And I'm going to go ahead and pass it over to my advocacy colleague, Dr. Kathy Burlingame, who will introduce our first presenter.
Well, thank you, Daria. It is my pleasure to introduce to you Kara Cook. She's got her MSN and an RN, as well as her AHN. She is the Director of Programs for the Alliance of Nurses for Healthy Environments. Her work has focused on elevating environmental health as a national priority by engaging nursing organizations, such as Sigma, and individual nurses in advocacy, education, and practice change. Kara has experience in critical care and public health nursing. So that's her bio that she shared with me. I also have to put a shameless plug that when I looked on the website, she has authored over 120 blog postings about climate change and health. So I would encourage you to also take the time to go look at those blogs. Thank you for allowing me to introduce you, and take it away.
Wow, thank you so much for that introduction. I was so excited when the Sigma team had approached us to do this partnership. I think it just really shows how influential nurses can be in kind of advancing initiatives around climate change and health. And so it's really awesome to be speaking with you all. I'm just going to give a kind of quick overview on what the Nurses Climate Challenge is, and talking a little bit about our progress and how we evolved this initiative and kind of where we are today with the Sigma chapter commitment. So, oops, sorry. There we go. So just to, before I jump into this, I am, as Kathy explained, I'm Kara Cook, the Director of Programs with the Alliance of Nurses for Healthy Environments. For those of you who are unfamiliar with us, we are a national network of nurses and nursing organizations working specifically at the intersection of human health and the environment. So we work on a number of environmental health issues, including climate change, which is probably our biggest area of work. At this point, I think because of how intersecting and overarching the climate change is, but also because of the interest we've received from our nurse members to want to do more around addressing climate change. And one of the areas in which our nurses were expressing interest was around nursing education. So as I know, as educators, I'm assuming most of you are educators on this call. You are probably very aware that nursing curriculum includes very little education around environmental health in general, or varies by school. There are some programs you'll hear from Dr. Hawkins shortly, who are, I would say, the leaders in kind of integrating climate and health content into nursing education. But if we look at across the country and kind of widespread adoption of integrating these concepts, we have a lot of work to do as nursing. And that also includes in continuing education. I think we see the most offerings around continuing education, but there's still within practice settings, hospital, healthcare institutions, there's not a lot of focus on climate change or other environmental issues. And so one of the initiatives we launched, and this was actually an initiative we launched initially with Healthcare Without Harm, but this actually last year, we kind of fully took over the initiative. But we launched the Nurses Climate Challenge in, I think it was 2018 now. And it originally started as a campaign to get nurses interested in climate and health education by providing them with resources to be able to educate their health professional colleagues. So we originally had an option where you could see kind of the nurse climate champions across the country and actually globally. And nurses would be able to register and become a nurse climate champion. We has since changed that kind of format, but I'm giving you this background because I just want to share how kind of quickly this was adopted by nurses around the world. I think pretty quickly we had over 350 nurse climate champions, and I want to say it was like 13 countries at one point. And we had an original goal of educating 50,000 nurses or 50,000 health professionals on climate and health. And we met that within, I think it was 2, 3 years. So that's really, really kind of exemplifies how quickly nurses were really, catching on to wanting to be part of something bigger and to be able to advance change within the profession and beyond. And so, oh, sorry, a little happy click there. This is actually, I'm giving you some snapshots from the new website. So, about a month ago, we launched the new website. It's now nursesclimatechallenge.envirn.org, and I can pop it in the chat after I'm done here. I might have I think I have it on the slide somewhere. But essentially, you don't have to register anymore to become a nurse climate champion. Anyone has access to the resources. And this is just kind of a snapshot of some of the resources that we have made available. And these are all Creative Commons. You can pull one of the presentations down, take out slides, adapt it to your needs in terms of who you're educating. And in addition to, sample presentations, we have guides on how you can take action, whether that be you personally or within a healthcare institution. We have, guides on how to be a climate advocate. We have some more sustainability focused resources in which nurses can learn more about how they can actually advocate for sustainability solutions within healthcare systems. So we've tried to reach across kind of this education, advocacy, practice change spectrum so that nurses at any practice setting or at any level of engagement on this, there's something in there for you all to utilize to be able to educate, your health professional colleagues. And this is just an example of some of what the sustainability initiative. So we have, this is kind of thinking about where emissions come from in terms of a healthcare system. And so this is kind of the areas in terms of if you're thinking about what kind of sustainability initiatives you can advocate for, you can look specifically at where the biggest emissions are coming from the healthcare system. And that includes, anesthetic gases, employee commutes, the food that's served in healthcare systems. There's a huge gamut of things that you can work on depending on your area of interest or, maybe your specific role within a healthcare facility. And this is important, for educators because I know not every nurse works in a hospital, but a large amount do, right? And that's usually where nursing students enter when they first, graduate. And so it's important for them to be able to understand how they can kind of be advocates and move into, growing their leadership as nurses within their career. And then this is, the bubbles turn green of all the ways that nurses can support sustainability initiatives within healthcare institutions. And one of those being educating, colleagues, your patients you're working with, just to kind of really continue to show the intersections of climate as it relates to other health issues. And then we also have on the website examples of the Nurse Climate Champions and how they've been utilizing the Nurses Climate Challenge resources. So hopefully folks can go ahead and check those out and be kind of inspired by the work that is being done. I will mention Jessica Madrid, because I know that Sigma is a global initiative. Jessica Madrid, she when she worked with us, she was the president of the Canadian Association of Nurses for the Environment. And her team actually worked with us to ensure that the resources were also applicable for Canadian audience. And so the ones that we have on our website are US and Canada focused. We also partner with, and I'm not sure if I have it on the slide, but I'll just mention it here and I'll skip the slide if it's coming up. But we also partner with Nurses Climate or Healthcare Without Harm, who does have a Nurses Climate Challenge Europe edition. So though that would be more focused for a European audience, and I would encourage if folks are in European countries to uh, check out those resources. And that has the same format where you have to, register to be a champion, but it's, a really kind of great sister initiative for you to get involved in. And then to just talk a little bit about the School of Nursing commitment, we were noting when we first launched within the first few years of when we launched the Nurses Climate Challenge, many of the users of the content were nursing faculty. And so we felt like that was kind of a unique thing we were seeing when we had such a large amount of nursing faculty accessing the resources. And we thought this could be a really great way to kind of showcase that leadership. But also, I think what we hear a lot from nursing faculty is, I don't know how to integrate this content. I don't have the time. I'm not sure what I should be doing. So, there's this whole idea kind of thinking behind that. If we build this kind of community and have some kind of sharing of best practices and how people work through challenges, then we could kind of help support those nursing faculty in kind of moving forward with this integration of content. And so we launched a School of Nursing commitment, knowing that entry-level nurses, graduate nurses need to have an understanding of how climate change is impacting healthcare delivery. And so in order to reach those students, we need to have nursing faculty who are able to integrate climate change into nursing curriculum. And so that's where this kind of School of Nursing commitment was formed, in which we started to partner with nursing schools and the Nurses Climate Challenge across the country. And so this is not the full list, but we have over 60 schools of nursing who have signed on to the School of Nursing commitment. And this is not, you have to educate this amount of people to be part of this commitment. No, this is just schools of nursing who said, yes, this is important. The dean or the leadership have said, yes, this is important. We have at least one faculty member who is interested in moving this work forward or supporting the work. And then, we're integrating some aspect of the School of Nursing or the Nurses Climate Challenge into schools of nursing content. And so that doesn't mean they have to make a climate change course. They don't have to change their, go through curriculum development change. It just means there's in some way, in some course, they're working to integrate this content. And sometimes it helps. Sometimes you just have to start small to kind of grow it. And again, this is kind of our full, how it's shown on the website, and you could actually on the map, click on the little green dots and it expands. It tells you which school, is involved. And so you can see, we have a little bit of, geographic diversity. Of course, would love to have more folks in the mid to western states. But yeah, it's great to see how this has grown. And then another thing I do want to mention, which we do have a lot of faculty who utilize, is this climate and health survey. It's also referred to CHANT. It used to be specific to just nurses, but we've actually expanded it so it's for all health professionals. But essentially what we were looking at is we wanted to be able to assess awareness, motivation, and behaviors related to climate change and health. And so we developed this survey, and it's actually grown. We now have it in English, Spanish, Portuguese, Italian, and Finnish. But essentially, what we're looking for is to have health professionals take this study or take this survey so we can kind of assess year to year how kind of awareness, motivation, and behaviors among health professionals are changing. And one of the cool things about this survey is that you can actually apply you can submit to WSU and say that you would like an episode code. So then you can actually use it as like a pre and post kind of assessment, which is many of our faculty have been using to kind of evaluate their integration of climate and health content into the courses that they're teaching. So you did want to make sure you all were aware of that. Oh, and there's this Climate Challenge Europe, so you can see the page. Again, hosted by Healthcare Without Harm, but they're great organization and great initiative, essentially doing exactly the same thing we're doing here in the US and Canada. Um, and then that kind of brings us here today. So I'm going to stop sharing because I know we have more speakers and content, but that was just a quick overview. Thank you, everyone. And I look forward to hearing the other speakers.
Thank you so much, Kara. I am now going to introduce our wonderful second speaker. It is Dr. Janice Evans Hawkins, who is an assistant professor and chair of graduate nursing programs at Old Dominion University. She's been a nurse educator for over 25 years with a focus on reducing health disparities. Dr. Hawkins is a retired Army nurse and veteran of Operation Desert Storm. Her nursing background and travels all over the world have led to greater awareness of global health issues and the need to develop nursing leaders to improve health everywhere. She works directly with the international organizations to improve vaccine access and reduce climate change impacts locally and globally. She's presented internationally and published in both peer-reviewed journals and popular media on topics related to global health, advocacy, and nursing education. Her contributions to the nursing profession have been recognized with her induction as a Fellow of the American Academy of Nursing. Thank you so much for being here to speak with us today, Dr. Hawkins.
Thank you, Michelle. I appreciate that. Let me get my slides pulled up and put it in presenter mode here. Okay, and then hopefully I'd still like to see the chat. Okay, perfect. Good to see everybody too. I see a lot of Sigma nurses online and the Sigma Academy graduates from more than one cohort, and even 3 of my students. You guys are super faithful to come. As well as it's good to see Liz, it's good to see you online, our Sigma president-elect. So it must be getting to about supper time for you. So I just wanted to share, I think my task today was this initiative stemmed out of this group's action plan for the Sigma Advocacy Academy, the Global Advocacy Academy. And I just thought it was such a great idea. The simplicity of it was fantastic. And to extend awareness and build on what Kara just presented as the nursing school commitment, which I first met Kara at a Sigma conference. I can't remember, Kara, I think it was about 2019 when Sigma offered a pre-workshop. I signed up for that and then took the training. So I was one of those more than 50,000 that was educated, that helped you reach your goal pretty early on. I learned a lot there and learned about the resources and just got more and more plugged in. So Daria and I were talking online before everybody logged in that thankfully we're seeing a lot more interest in this and a lot more awareness. So my goal today is to share some ideas, but I hope you guys will share some ideas too of what you're doing in your chapters. Start off with why us. Climate change negatively impacts health, and we're nurses, so we should care about that. And our healthcare systems contribute to the problem. So we need to be involved in kind of the do no harm. Nurses, we're in a position to do this. There's a lot of us. We're the largest group of healthcare professionals, making up 27 million worldwide. As part of Sigma, we have over 600 chapters worldwide, and we're the 2nd largest nursing organization. And of course, for the Sigma members that are here, you guys likely know, I think most of you likely know that Sigma, we gained ECOSOC special consultative status with the UN back in 2012. And as part of that, our commitment is to advance the SDGs, and climate change, addressing climate change is one of those. So we do, as an organization, we do have a goal and a commitment to help increase awareness and engagement with the SDGs. So that's part of what we do. I tend to kind of float around a couple of these more often than others. But I think a good approach to that as chapter leaders and even as individuals, and we also have some educators on the line too, is we need to educate ourselves about it. So, doing things like attending Annie's workshop, then we can educate others, whether that's our coworkers, our students, our fellow faculty members, and then we can also take action ourselves. So I'm just going to go through a blur of things you could do if you, as a chapter, signed on to this commitment. And I agree with Kara's approach. When you sign on as a school chapter, you're not necessarily signing on to change your entire curriculum or to even build a single course. It doesn't have to be that. As Kara mentioned, it could be just as long as you're committing to inserting some content in your curriculum, whether that's a small module, you can do that. So if you're a Sigma chapter that already has, something that's very important to you and you kind of feel like it's what defines you as a chapter, you can still do that. This could just be a monthly meeting or even a newsletter insert or column. It could be very small, but all the small things by all 600 chapters and over 100,000 members really add up. So one thought, designate a chapter champion. Could be someone who's already in an officer position, but could be a separate role where you have someone that maybe monthly wants to put out some information about how to take action with climate, or even yearly. But designate a chapter champion is a great idea to keep initiatives at the top. Promote Annie, of course, that aligns because we know that Annie has a lot of resources that we use. And one thing to add to this is subscribe to Annie's newsletter and updates, because that's where I find out about where I can sign on to maybe legislation or sign up for a webinar to learn more. So I think promoting Annie, that's something that simple you can share with your members that, hey, there's a webinar that Annie's doing. So you don't even have to host it as a chapter leader. Start a journal club with Virginia Clinicians for Climate Action. We, once a month, we have actual students typically share an article related to climate change and give some outcomes with that. It doesn't have to take up a whole meeting. It could just be a 10-minute presentation at the end of a meeting, or it could be, again, just an annual event. But it's a great way to catch up with the recent literature. Could make it research, or you could just make it sharing good ideas. Host a webinar or an annual climate change lecture. That's pretty easy to do. Annie has quite a few speakers, and also Eco America Climate for Health Ambassadors. If you sign up for that initiative, which I'll share in an upcoming slide, they have a list of speakers that are willing to come and talk about health impacts of climate change. As Kara mentioned, there are already some resources available that are PowerPoints and things like that are already started, so you don't have to reinvent the wheel. There's also quite a few. Invite somebody from a local hospital that started an initiative and making changes at their hospitals if you want to have a live dinner presentation. So it doesn't have to be a webinar, could be your annual dinner presentation. This is something we do at ODU. Now, the students that are here are saying, well, I don't remember doing that. I agree. That's because they're undergraduate students. But what we did with our undergraduate students is we had them do a energy efficient treasure hunt around the university. And this Green Team Walking Windshield survey is about 2 pages long. And they went around and looked for ideas on campus, both within our School of Nursing, but also in the dorms and in the buildings, of ways that ODU could save energy. And then they even ended up presenting that to our sustainability work group. And I'm actually pretty happy to say that one thing that happened is we had an entire room of computers that just stayed on all night, 365 days a year, with no one using them. Everybody brings laptops anymore. We did a survey and found out that those computers hadn't even been logged on to, but maybe 3 times in the past couple of years. So we took them all out. And we're not using that anymore, but I had lobbied to get them turned off. But finally we took them all out.
I'm
So
sending
we
it
got
now.
some great ideas from just looking around campus. And then I also briefly mentioned the ambassador training. Eco America offers Climate for Health Ambassadors, offers an online, on-demand ambassador training. I have a feeling that a couple of the ODU students on here have taken this, but all of our undergraduate students do this as a course assignment. It's about a 3-hour training. When they finish taking the modules, they just upload the certificate of completion. They can put that they are Climate for Health ambassadors on their resume because they've completed the training. They can then sign on to do more if they want to. And so some of our students have gone on to give lectures to freshman nursing students to let them know more about it. So that was pretty exciting that they then took a leadership role to do that. But even just becoming more familiar with how to talk about it, I think is a good part of these modules. And it's very easy as an educator in my role, but in our role as chapter leaders to just share this opportunity. And again, as an educator to put it in a class because it's on demand. So I can use it anytime, week 12, or I can use it in the spring semester or fall semester. So anytime you wanted to use this as a chapter leader, it's always there and available on demand. Other things we can do as chapter leaders, we can amplify the message. A lot of chapters have individual newsletters. So in your newsletter, you could do a little climate action column where you each, maybe every month when you send out the newsletter, you have an idea of something that your members could do. Or maybe you have a blog that you send out once a year with that. You use social media. A lot of chapters have their own Facebook page and Instagram accounts, or websites. You could update your websites to kind of amplify the message of what you're doing in your chapter. Or, I'm looking at the group that did this initiative. Are we going to have a little badge or something that shows that we've logged on? Because that might be something we want to have on our website, kind of like the Nurses Climate Challenge. Maybe you can answer that when we get to the end if we're doing that, so that we have a way to show that we've made the commitments for those chapters that have. A lot of you have seen this before. I love this picture. At ODU, we were able to get a grant from the Virginia Forestry Department and plant trees on campus. Students loved it because they got to get out of the classroom, and they're so busy you can tell by their faces, they're just having a good time. But the other thing we did is we learned about how trees positively impact climate, and we were able to talk about that. And so we did a class again for freshman students about the positive impact, and we even made the evening news. I think you can transfer this to your chapters. You may not apply for a grant as a chapter, but maybe what you do as a chapter is you plant a tree or you donate a tree to something. Trees are for purchase and can be part of we can maybe decide for our chapters to be carbon neutral. And one way that you can be carbon neutral is to buy carbon credits. So you can buy trees and then donate them to hospitals or healthcare industries or neighborhoods or things like that. And that could be a Founders Day event to purchase a tree. Write letters to the editor or blogs. There's a rubric for writing a letter to the editor. So you could host an entire chapter meeting on even just teaching. I now kind of have a presentation on writing a letter to the editor. And we added a few slides for those of you that were on the most recent Global Academy Advocacy. You kind of asked, could we learn more about that? So we added a few slides because there's a rubric for writing a letter to the editor. So you could hold a chapter meeting and everybody look at what it takes to write a letter to the editor and sit down and write one together, kind of like we used to have a phone bank in the old days where we'd all get together and make phone calls. You could have a writing workshop. You could, as a chapter, you could order and distribute the Climate RX badges. I don't know, I assume a lot of you are familiar with this because, again, usually those on the call are already doing the work, but you could order the badges and then pass those out to your members, or when you have other activities. And the climate badges are designed they're no cost, they're free if you order them, if you have a group to give them to, and it's designed to keep the conversation going so our patients can learn more about climate and health impacts, and that's how we can initiate conversations. The other thing you can do is you can share tools for nursing assessments and patient education. Annie has a lot of these tools on their website. So again, those of you, whether you're educators and you want to use these with your students so they see the tools, but if you're in clinical practice, which that's one thing I like about this initiative is it gets beyond, as Kara said, a lot of those that got started in this content were the educators, which is great because the next generation is going to know more as they graduate. But we also need those in clinical practice to be engaged in this material as well. And here's one way is to learn about the resources here and share them with your chapter members who are out working in the hospitals and let them know about the tools that we already have made. Here's the like a badge I was mentioning, you can sign on to the School of Nursing Commitment, which was the Nurses Climate Challenge. Previously, ODU signed on to that several years back, and we were able to pretty quickly add some modules into our content. I will tell you that our students were surprised it wasn't there already when they learned that it was new content. Now, this was about 5 years ago, but when they learned it was new content, they're like, what do you mean we weren't already teaching this? So they really liked it. We did a survey, and well over 95% said it was great content, that we should keep that, and that they were interested in it. That we were able to couple that actually with ODU did a theme semester. And I offer this because as Sigma chapters, I think the other thing that you could do is you could lead curricular workshops. So whether the workshops are curricular workshops for nursing education, but it also could be for staff development. So that as a Sigma chapter, you could share, kind of like one thing Kira mentioned is what everybody wants is something that they can easily insert. Everybody's so busy, they don't really have time to invent and create all this content. So if a Sigma chapter champion could find some of that content and share it, or help create that and put it in a package that staff development could use, then this could become a staff development workshop, or again, a curricular change. At ODU, we did it as part of a theme semester, and then that theme semester across campus, educators were supposed to be working on sustainability ideas. So it was really fun to be a part of that within the School of Nursing, and to talk about the health impacts of that. As also things that I think Sigma chapters can do is let others know about access to some of the resources, such as the free textbook. So the educators will appreciate this, but the free textbook is available online, so very easy to grab some modules from that. I don't even know if this is the most recent edition. There was a third edition in progress. So Kira, I apologize if this picture's old with that. But also, in addition to, again, well, this is kind of a repeat, but I put it on earlier that I was recommending that chapters take the ambassador training. But then if you're talking about curricular updates, I also recommend this as a potential easily insertable module for your students. And once they do the modules and complete the training, then they get access also to additional PowerPoints and things that are already ready and can be edited. And the nice thing about this too is there are several that are available by state. So I just recently gave a presentation to World Affairs leaders in Virginia, and I was able to go to the site and grab some of the slides that were Virginia specific, so that we could talk about here in Virginia. We're concerned with sea level rise. And so I was able to put some things in that, and also had very specific things about the increase of ticks and Lyme disease. So it was of interest to the audience that was local. So those are very helpful if you're trying to make it, maybe you're trying to share something with civic leaders or those that are potentially outside of nursing that have a possibility of influencing policy at the state level, or understanding why they might want to care about it. So that's another resource to share. The other thing that, as part of the curricular updates that faculty may be interested in, and this is actually a student-initiated process, is the Planetary Health Report Card. So a few students, in fact, I should be able to name them, but the goal of this was to grade your curriculum on whether or not it included climate content. And so you can have your students, you can encourage your students to complete a Planetary Health Report Card, or they can do it on their own. They don't actually have to wait on you. So sometimes you might get a low grade on that if you don't have that in your content, but I think this is a great initiative. Another suggestion for chapters champions, and I'm really assuming, and also because I recognize a lot of you, that we have a lot of chapter leaders on the call, but as chapter leaders, maybe you want to create a contest and you just send out something, have a monthly contest where you develop some type of point system where individual members can work to reduce their carbon footprint. So maybe they get a point for every time they carpool to work or take public transportation, or maybe work from home on a day, they get points for things like that, or if they reduce their waste or things like that. So thank you, Michelle Kemp. Boy, I appreciate appreciate, I knew somebody on the call would know that. I feel bad that I didn't actually look that up ahead of time so I could give their name. Other ideas that you could do as part of the contest is maybe share ideas for reducing personal energy use at home. And again, then turn that into a game or a prize or annual award where maybe others are encouraged to update their insulation or recycle and compost at home. I know here in Chesapeake, we have a big initiative. I'm in Chesapeake, Virginia, and our recycling closed. And that created quite a community uproar. But what was happening, and it won't surprise some of you on the call, it was actually costing the city a fair amount to recycle. A big part of that is because we don't do a good job of sorting. And then a lot of it that was going to the recycling plant had to be sorted, and it was costing the city a lot of money. On the ballot right now is an initiative that Chesapeake citizens can vote on whether or not we want to implement a mandatory $10 fee for everyone and bring back recycling. So hopefully that'll pass. There's been a group that's been involved with that, but those are, things that you can get your chapters on locally if there's initiatives, but encouraging recycling and composting. Of course, we have other options. We could recycle at recycle drop-off places. Encourage biking and public transportation, encourage reduce food waste, convert to electric with your appliances. Those are just ideas for things at home. I know that I've shared this with several of you before, this article that we wrote on reducing the carbon footprint of our health systems, and we just gave A to Z 26 ideas on how to do that. I'm going to share a few of them, but I'm hoping you'll go read the article if you haven't already. This was written with two of the Sigma United Nations youth liaisons. The three of us presented this at a Sigma Chewy conference maybe 4 years ago, and then wrote it up as an article. And so I'll just share a few ideas. I like these because tying them to saving money makes them an easy sell to your boardroom. Everybody likes to save money, and so if it's not costing them anything and it's actually saving them something, it's a good initiative to change. So you can take these to the C-suite. Sharing a few ideas: adopt green lighting. Mission Community Hospital in California saved $350,000 annually when they changed out all their former in their parking garages and clinics. They changed their fluorescent light bulbs and other incandescent light bulbs out to LED lights and saved that much money. You'll see I'm skipping a few. I'm not going to do all 26, but compost food waste. In Hudson Hospital, Wisconsin, they saved $88,000 in 1 year by reusing food, compost and food waste, and they donated that to a community garden, so even a better community initiative. E for eliminate single-use plastics. A hospital in Newcastle saved 12,000 pounds on just cutlery alone whenever they opted to go with not having plastic cutlery anymore. So none of that's going in the landfill. And a lot of times when we talk to other medical providers and we say eliminate single use, we're talking about medical equipment. And there's some challenges there because we also have to reduce infection control, but we could also look in our cafeteria and maybe rewashing forks and spoons would save money. This is a big one, go green with anesthetic gases. Such a big one because so easy to save a lot of money. Providence Health Hospital and others now have done this, prioritized use of sevoflurane and saved over $500,000 a year. I've heard of several hospitals too now that are doing away with some of their wall systems and using tanks because there's less waste that enters into the atmosphere. So that probably saves money too. This is my favorite one. This is from Sarah. I often share a story about Sarah, who works at Carilion in the western part of the state, who created her own job. She's now the sustainability officer for that hospital because she started looking at ways to to be better efficient, but then save money. And she ended up saving enough money, it created her own job. So now she's the full-time sustainability officer as an RN there at Carilion. And one of the very simple initiatives, this was published in AJN a few years back, is they lowered linen par levels and saved $83,000 in 6 months by not taking so many sheets into the room and then having to wash dirty ones. We wash over 5 billion pounds of sheets annually. And then also by not changing the beds quite as often if they didn't need it. M for maximize supply chain efficiency. And I kept this one in too because I thought, as chapters, we can do that too by trying to order locally or order in bulk if we're ordering pens or things like that, maybe by picking up when we go to a Sigma conference, rather than having things shipped, we pick them up when we're there. Hospital waste, 25 billion in supply chain spending. So if we can do more, we can save money by bulk ordering and not having quite as far to ship if that's possible. And the last one, work from home. Transportation is one of the biggest contributors to greenhouse gas emissions. And if we could work from home 2 to 3 days a week, we could reduce our transportation by 15%. And it also has been found to support reduced absenteeism and turnover. Now, we know as nurses, we can't really take care of patients from home, not completely. There are some clinical jobs that are remote. But if we have other opportunities to maybe not drive in for that staff meeting or things like that, there may be other opportunities to look. Second article, I don't share any of the strategies here, but just to let you guys know, you can go take a look at this or write some of your own. But there are certainly within departments, we could share strategies on how to reducing carbon emissions specific to radiology or in the OR, a lot of waste in the OR, or maybe within our clinics, our university systems, or wherever we are, that they're just the thought of what can we do to reduce waste. And tried to get through that in time because my hope was that we could share strategies that you guys are doing or answer questions. As I know, looking at all the names on this call, I know a lot here are already plugged into this. So just quickly wanted to share contact information if you want to follow up with any ideas. For example, I'm happy to share that the treasure hunt that we kind of revised. We got that. We borrowed it from Energy Star, but we adapted it so it would align more with like our setting. But I'm happy to share what we did. And that's all I have, Michelle. Happy to turn it back over to you guys or take questions.